This program on investing under regulation crowdfunding is not investment advice.
Rising with the crowd, power unbound, change makers lead where hope is found. Superpowers for good, shaping the fate. Investors and dreamers open the gate. Supercross stands loud, proud and true, building tomorrow for me and you.
Have you ever thought that healthcare should be cheaper, more effective, and just better? Well, we've got a great guest today who's making meaningful progress in that regard. Stick around. You don't want to miss this episode. Now, welcome to the Super Crowd Presents Superpowers for Good. I'm your host, Devin Thorpe, and our guest today is Dr. Steven Steinberg. He is the founder of EndoSound, and they've got some amazing technology to help you get key diagnostic testing done more effectively and more cost effectively, as well as more medically effectively. So, Dr. Steinberg, walk us through, how does this work?
So thanks, Devin. First of all, thanks for having me on. It's a real pleasure and an honor to be on this format. So EndoSound has pioneered and disrupted an area called endoscopic ultrasound. And I think everybody hears that and maybe your eyes glaze over. But most people are familiar with regular ultrasound from the outside in. You've seen that with a gender reveal. Somebody might have had an ultrasound examination that looked at their heart, a variety of uses. Endoscopic ultrasound is simply taking that same technology, putting it in on the end of a scope that goes through the mouth and into the body, and then providing views from a different vantage point. So the technology is the same, but because the vantage point is different, we get access and imaging of tissues and areas that are otherwise not available. So if you think about it, endoscopic ultrasound is another imaging technique. It's an imaging technique like MRI, like CT scan. And when you have an imaging technique, if you can see something, you could do something. And the big advantage of endoscopic ultrasound is that we see things real time. So we're actually looking at an area. Perhaps it's a mass in the pancreas. We can see it with our ultrasound, and we can then guide a needle into that tumor, into that mass, to take a sample. It allows us a whole host of diagnostic opportunities and an equally broad landscape of interventional treatment opportunities as well.
Yeah, it's amazing stuff. And your tool is kind of the state of the art. It's saving money and improving the effectiveness of this. What's the magic of your technology in this space? Are you the only product that's doing the kind of the inside out ultrasound?
Yeah, so good question. So endoscopic ultrasound's been around for a better part of 25 years. I've been doing interventional endoscopy, so-called therapeutic endoscopy, for the better part of 40 years. What that means is that we do various techniques through a scope that's inside the body, and it's essentially minimally invasive surgery. Over the years, endoscopic ultrasound has become one of the major tools that I get to use in order to do some of these techniques. And it's become really the mainstay of my activities. There are a number of other companies, 3 major ones to be exact, that have technologies out there for endoscopic ultrasound. The difference is that those technologies come at a cost factor that is exorbitant. And so to set up a simple system in a hospital or a surgery center would cost on the order of $500,000, where our system operates and is established at about 10% of that. And the way you do that is by taking the kind of endoscope, a so-called upper endoscope, the one that goes through the mouth, that's found in every endoscopy center, every doctor's office where endoscopy is done. And we adapt that scope that they already have with an ultrasound technology so that we're building on a platform that they have, and providing a much more cost-effective, much more accessible opportunity to do endoscopic ultrasound.
That's really interesting because, the budget that you're talking about is really, you know, in this day and age, right? That's less than the cost of a major procedure for one person.
Yeah,
So most, so every surgical center and hospital, this is, it sounds like big dollars if I were thinking about buying one of these for my house, right? But for a surgical center, this is a tiny budget. That's really kind of amazing.
Well, so the challenge is because the cost has been so high in the past, 80% of hospitals and about 97% of surgery centers lack the technology. They don't have it because the burden of capitalization, the burden of acquisition is so high. And that provides us with a huge opportunity to generate a market. And the market is rather substantial. Surgery centers, gastroenterologists do on the order of 6 million diagnostic procedures every year. If those diagnostic procedures were enhanced with endoscopic ultrasound, not only would the patients benefit by earlier diagnosis, less expensive diagnosis, the surgery centers would benefit with a revenue stream. And for us, it represents a huge market opportunity with TAMs in the billions of dollars.
It really is exciting. Let's talk a little bit about that. You've just hinted now that this is a big marketplace. There's no question that your device gets used over and over again. How many places are there in the world that could buy one of your products ultimately?
Well, I think, given that what we've tried to do is to base the technology on scopes and platforms that gastroenterology physicians, surgeons sometimes already have, all of those people are potential clients, audience for our technology. And it's gotten, it's really come to the forefront when we look at not only the diagnostic and treatment capabilities of this technology, but also the screening capabilities. You may have seen recently that Jeff Bezos and a team purchased a minimally invasive cancer treatment technology on the order of $22 billion for the purchase. That's a treatment that uses and aims at tumors that have been discovered. We operate as the front door to that kind of technology because we do screening. We can find the tumors that can ultimately be utilized in those minimally invasive techniques. And the real goal in all of this, at the end of the day is how do we improve patient care? How do we improve outcomes? For example, the outcomes in pancreatic cancer have only improved from about 5% 5-year survival 15, 20 years ago to 12% 5-year survival more recently. And the reason for that is that we don't find the tumors early and we don't find them when they're small. And our technology has the ability to impact that curve. We're trying to bend the curve to make it so that patients are have their tumors caught earlier so that they have access to the kinds of treatments that Jeff Bezos is talking about.
It is exciting to think about anything that improves healthcare, and it's especially exciting to think about things that lower cost and improve healthcare. And we're at that intersection with what we're talking about here. It's wonderful news. So, Dr. Steinberg, as you look at your career as a medical doctor and performing these procedures over many years, what led you to launch into this career now as an inventor, entrepreneur?
Yeah, I think I was probably off my medications when I did that. But I think as I mentioned, I've been doing therapeutic interventional endoscopy, minimally invasive surgical procedures for the better part of 40 years. A large portion of those procedures are now endoscopic ultrasound based. And what became apparent was that my backlog of cases, my waiting times were getting longer and longer. And to a large degree, the reason for that was the lack of access. That is, there were not local places that had access to endoscopic ultrasound to meet a very, very significant patient need. And so I began to think about possibilities for changing the access um, uh, diagrams. How would that look? How could we get patients in sooner? How could we get the cost factor down, which is also, as you know, a big access point of concern. And then lastly, the underdeveloped world, the world with lesser resources, has virtually no access to a technology that is critically important to the health and well-being of their patients. The World Health Organization came out and designated ultrasound in general as the most cost-effective, best bang for the buck technology that under-resourced areas could avail themselves of, and our technology fits right into that.
That really is exciting to think about. Having spent a lot of time in low-income countries, it's scary sometimes to see what passes for a clinic. But it's all the resources they have, and it's wonderful to think about bringing this kind of technology closer to people who need it around the world as well. The impact potential here is just enormous, and of course, that just proves that also the size of the market. Right, there's an enormous market here. Truly global for this business. Very exciting.
And so to their credit, we have at least two of our gastroenterology worldwide organizations, the World Gastroenterology Organization and the World Endoscopy Organization, both of which are aimed at training physicians in underserved, under-resourced countries, in some cases with as many as 100 training centers available. And so our aim is to partner with them so that we can get that technology out there.
Wow, that's great. That's great. Well, listen, Dr. Steinberg, we've got to take a quick break, but when we come back, we'll talk to you more about your superpower. So stick around, okay?
I'll look forward to it.
Listen, folks, I'm here with Dr. Steven Steinberg. He is the founder of EndoSound, this amazing endoscopic ultrasound technology that is dramatically lowering the cost and improving care for potentially billions of people around the earth. And they're raising capital from the crowd. You can invest. Visit s4g.biz/endo. That's s4g.biz/endo. Those of you who are watching can see it on the screen. I encourage you to check it out. This is really an exciting and worthwhile opportunity to explore. Now, we're going to take a quick break, but when we come back, we'll talk to Dr. Steinberg about his superpower, so stick around.
Download a free copy of How to Make Money with Impact Crowdfunding, the book Sarah Hanks describes as
a fantastic overview, not just of crowdfunding investing, but of investing in general.
Andrew Savickas raved,
"This book offers unparalleled insights for anyone looking to make a difference."
Scan the QR code to get your copy.
Struggling to raise capital for your business? Unlock the power of the crowd with AI. My free guide, Crowdfunding Made Simple, walks you through every step to success. Get funded smarter, faster. Scan the QR code now for your free download. Welcome back, everyone. I'm your host, Devin Thorpe, and I'm thrilled to have with us today Dr. Steven Steinberg, the founder of EndoSound. This is really an amazing technology that is improving healthcare and lowering costs. What a pair of impacts. And now we're going to shift gears. We're going to talk to Dr. Steinberg about his superpower. Stick around. Dr. Steinberg, you've done some amazing things. Of course, you had you've had a stellar career up to now and continuing as a medical doctor. But now you've launched this amazing company to commercialize a revolutionary technology and technological improvement. I'm excited and grateful that you're here. What is your superpower?
I thought about that, Devin, coming into this show, and I, I think if I had to point to something, the two words that come out would be courage and tenacity. And by courage, I don't mean, gee, I'm going to go out and be courageous today and do something heroic. What I think about is the fact that courage is what happens when people are faced with terrifying circumstances. And for us, for my wife and I, when we were in training, that was the birth of our first child, who was born with a very challenging heart defect that was life threatening. He wasn't expected to live beyond a couple of years. And that's, I think, when you discover courage, not because you choose to, but because circumstances are put in front of you that require you to try and figure out how you're going to get through a circumstance, how you're going to push through. And that's where the tenacity comes in. And you look at those people around you, you look at that little baby who's struggling for life, you look at the physicians who literally came to our rescue, docs who were courageous in terms of utilizing technology that was cutting edge, in taking their best experience and their best advice and putting it to work to rescue our son. And they did that. They got him through it, and we sat there pushing through with tenacity to try and support him and get him, to the point where he was out of risk. And so you look at those kinds of circumstances. I'm sure everybody has them in their lives. We then got to do it again, because 4 years later, we had another child, and this child also had a different heart defect. And we went through some of the same things, this time knowing that between the two of us, we could draw on the courage that we had to try and push through, and the tenacity that it takes to stand there and do all of the things that you need to do when you're tired as can be to get through to the other side. And so later on in my career, I got into the position where I was doing therapeutic endoscopy. It's a great space to be in, because I get not only to interact with patients who have problems, but to be able to not only diagnose them, but to intervene, to improve the quality of their life using endoscopic ultrasound and other techniques. I get on occasion to save lives. So I have one woman whose husband we picked up using endoscopic ultrasound with a small cancer of the pancreas. We were able to treat it successfully. And we have this lovely letter from her talking about the now 58-year-long romance that she gets to continue with the love of her life. And I think what I take to that for my everyday is that there will be things that require you to be afraid, to be terrified, that most of us can look within ourselves and find the courage to deal with them and the tenacity, hopefully, to push through to the other side. And in business, business is kind of a pales comparison to family illness, but many of those same principles apply to business as well.
Well, that it is so true. It is so true. I feel for you, having experienced some of those challenges, with your children and the heart conditions. That's scary. I think the lessons you learned, though, from that are quite powerful, aren't they?
So, and by the way, I'm sorry, I forgot to give you the tagline. The tagline is that both of them are adults. They have given us 6 of our grandchildren. They occasionally run marathons. And so all of the hard work of the docs that helped us and the technology that helped us essentially gave us our lives.
That's amazing. That's amazing. That's wonderful news. Wonderful news. As you think about that tenacity that is such a power in your life, what would you recommend to people who you've worked with to develop their own tenacity, to make that stronger?
I think, it starts with the mission. It starts with something that you're committed to. And so for us with EndoSound, with the company, it was really about access. How do we improve access and therefore care and therefore improve costs for our patients? And if you have a mission, if you have something that's in front of you that you're striving for, then the tenacity follows on because you can see where you're headed. You can see what the goal is. And surely there will be obstacles. Surely there will be things to overcome. But it's much easier to do that when you've got a light at the end of the tunnel and a vision in front of you, and a vision that's important to you, important to perhaps your family and your colleagues. And ultimately, in our situation, we hope important to the world.
That's such a great, I think, guiding principle for strengthening your your tenacity. With that, starting with a purpose, a mission. As you think about your business, how are you applying your tenacity now at EndoSound?
So I think that, we have come in as a disruptive technology. And so anytime you're a disruptive technology, you start with early adopters and you have to work really, really hard to get to the tipping point, right? And so that's where we are. We've gotten our initial sites. A number of them are doing 100 procedures a year now, one over 200. And I think it's my view that as we push hard at getting more and more of our sites up to and across the finish line of 100 per year and more, that ultimately there will be a tipping point where the market will look at that, and those people who are just simply normal adopters will say, hey, I need to be a part of that. It's not only helping patients, it's not only saving money for patients and insurers, but it's actually financially favorable to both the physician and the sites at which the physicians work.
Yeah, that's such a great combination of factors. As we wrap up now, I wonder if you would take a minute and tell people how they can get in touch with you and your team members, how they can follow you on social media, and of course, remind people how they can invest in EndoSound today, because I think a lot of people are going to be interested in that.
Well, thank you. It's really, again, we're really grateful for the opportunity and honored and delighted to be a part of this activity. Our funding activities, as you may have heard, and I think it's seen on the screen, are currently through WeFunder /EndoSound. But you can certainly contact me at Steinberg at EndoSound.com or any of our team members at info@EndoSound.com. You can follow us at LinkedIn and see all of the exciting things that are happening along the way, and follow us on our journey. We're really anxious for committed people to join us. What I can tell you is, for example, that virtually almost all or many of the sites that have taken on our technology, many of those doctors have become investors after they used our device. And many of our investors are people who are knowledgeable in the field as either physicians or as people in the medical device space.
That's wonderful. That's wonderful. As we, I really want to thank you, Dr. Steinberg, for taking the time to be with us today. Your message is so hopeful, right? That there is an opportunity here to not only reduce cost and improve care here domestically, but around the world, including in places where there are no endoscopic ultrasound options. And that really is inspiring to think about the potential impact of this business on the world for good. So again, I want to thank you for taking the time to be with us today and wish you every success in the great work you're doing.
Well, thank you so much. And again, it's that vision that allows us to get up in the morning with a lot of energy and a lot of excitement. So I really appreciate the opportunity.
Well, thank you. Now, let's do some good.